Hi, Dr. Kent Sasse here at the Continence Center. Can bladder leakage be fixed? This is the problem that a lot of people are facing, and a lot of people want to know exactly what is the answer to that problem. First of all, where does it come from? We know it's partly just a result of biology and bad luck, kind of how we're built. We know that pregnancy and deliveries play a role by tearing the muscles and stretching the nerves. We know that many other inputs can damage the pelvic floor, the sphincters, the muscles, and the nerves, including medical treatments, medications, radiation therapy, surgery, damage to the spine through trauma or surgery, and then age. So many things can contribute to this incredibly common problem of bladder leakage. But can it be fixed? The short answer is yes. It sometimes requires a combination of treatments, but usually they're pretty darn good. As you know, if you've seen our other materials, my videos, or read my articles or blogs, we view the cornerstone treatment, the safest, simplest, least invasive, and most effective treatment as one that switches on your normal anatomy, switches on your nerves and muscles to restore the pelvic floor, doing what it was designed to do, using some technology. The technology acts a little bit like a pacemaker, so it sends a signal, which is a computerized signal, to re-stimulate the pelvic floor muscles to work like they're supposed to, and that works both forward in the bladder to restore the sphincters and avoid the spasm or overactive bladder responses, while also preserving the control. And it works in the back or toward the rectum area to restore the sphincters and its control and avoid abnormal rectal evacuation and avoid the leakage. So that's our cornerstone therapy, but there are quite a few other therapies that can play a role. So let's kind of walk through what those are. Well, first of all, our favorite is exercise, because we think the combination of technology and exercise is often the very best solution to get the best results for many, many conditions in the body. And exercises in this case means starting with simple Kegels or squeezes of those sphincter muscles, but then advancing on to more advanced exercises that really fall into the realm of pelvic floor biofeedback therapy. So at our center, we have a free course that has a series of exercises with instruction that teaches a person to engage those pelvic floor muscles in a number of different ways. It involves using the whole body to engage those pelvic floor muscles with these specific exercises. So together with sacral neuromodulation, that technology part, plus the exercise part, we think that we're over 90% of the way there, and for most people that has solved the bladder leakage problem. Well, you might say, what about other therapies? What about medications, for example? And as you probably know, that class of medications is one of the most sold medications in the world. There are so many people who are looking for a solution that the drug companies are selling immense amounts of medication for this problem. However, the published data about the medication success is pretty poor. The medications do not work very well for people who have more serious leakage. They do work for some people who have more mild leakage. But more concerning is that the vast majority of the medications fall into a category of medications called anticholinergic medications that are strongly associated with memory loss and cognitive dysfunction, especially in older people. And since the problem of bladder leakage occurs primarily in older people, and because the side effect of this medication is to impair cognition, brain function, and memory, we don't think, and AARP doesn't think, and many other advisory groups do not think that those medications are good to be taking on a long-term basis. So while they may have a little bit of effectiveness, and while there are two newer medications that may have a little bit more effectiveness, in general, these do not help for the kind of people that we see who have tried a lot of other therapies, including medications, and they just are not effective at solving the bladder leakage problem. So we're not real big fans of the medications, but we do sometimes employ one of them in concert with our other therapies in order to really try to get the best results when nothing else will work. What about additional therapies? Well, there are therapies that involve injecting Botox or botulinum toxin into the detrusor muscle to create relaxation there and to help prevent the evacuation of the bladder with leakage. And this has some success, but as you know from the way Botox works, if you've used it or encountered it, it's temporary. and that effectiveness often wears off over time. Sometimes it can be a shorter and shorter amount of time that a person enjoys some relief in between procedures, which might start out as every 3 months going to the doctor, having a procedure, which can be a bit uncomfortable, and then continuing on with these ongoing treatments, which eventually may wear off after less and less time. I frequently hear our patients tell me that, okay, I've done 7 Botox treatments and the last one only lasted a few weeks, and they just don't feel like that's a lasting solution. Whereas the solution that we're so fond of is very long-lasting, kind of permanent solution, and the sacral neuromodulation is an implanted device that doesn't have to be, you don't have to go see the doctor over that. That can just be, on humming in the background, working for decades. There are 1 or 2 other therapies out there. One of them is kind of a peculiar therapy that stimulates the tibial nerve down in the lower extremity. And this has an interesting effect of mimicking some of what sacral neuromodulation does. But once again, it's very temporary and involves repeated visits and procedures in the doctor's office, which can be quite frequent, often monthly, with no real long-term advantage. So those are kind of the range of therapies. I did not hit on actual surgery because surgery sometimes is necessary or helpful. So there's a large published literature about pelvic suspension type procedures, especially for people who have pelvic organ prolapse. There's a large literature about sling procedures for bladder slings. At our center, most of the people, maybe close to half of the people who are seeking help have actually already had a surgical procedure or bladder sling which has failed. The published literature shows some significant effectiveness of those procedures for the right person, but I think in practical experience and over the years we find that in many cases they're not very durable, and when there is such less invasive treatment available with this 20-minute sacral neuromodulation procedure, we feel that that's a far less invasive solution. Lastly, there are injectable agents, and these can sometimes help when the control is better, but we still have some leakage, especially with coughing or sneezing or lifting, the so-called stress incontinence. So that avenue where there can be injection of a filler type material around the urethra can be pretty effective at sort of bringing the whole solution across the finish line to where it's 100% effective. The agent that seems to be the most effective there is called Bulkamid. There have been a few of them over the years. This still requires a cystoscopy or a scope in the urethra in this injection procedure, but it does seem to have some effectiveness, so we sometimes will employ that in concert with the other therapies. So that was a long list of potential therapies, but I'll just summarize by saying that yes, bladder leakage can be fixed. The vast majority of the time, in our view, it can be solved with an exercise program combined with something called sacral neuromodulation, which restores your own body's pelvic floor action without having invasive surgery and without taking long-term medications and without having to have repeated procedures with doctors. Much as you might love us doctors, we kind of understand if you don't want to be seeing us all the time. So we think that that combo really fits the bill as being the most effective treatment for the vast majority of people, and that solves the bladder leakage for the vast majority of people. But in a few cases, sometimes we think there's a role for injectable treatments, for surgical treatments, and potentially even medications in some cases. I hope that's been helpful at kind of framing the way that we solve bladder leakage for most people. And I hope that if people are telling you there is no solution, just know that you might need to do a little bit more digging and researching and find some really capable people who can solve that problem, because it most definitely can be solved. I wish you the best of health.